Hi, I'm Dr. Molly with Your Goals Physical Therapy. Recently, my family started investing in bikes. So my son is 6, and I was able, up until very recently, to run next to him while he was riding his bike to make sure, he's safe. But he can now run or bike faster and for longer distances than I'm able to run to keep up with him. And so we have decided to buy bikes so that everybody in the family has them. My daughter is a little young, so she now rides on the back. But this has opened up this whole other world that I had almost forgotten about because I'm such an avid runner. But bike riding is a lot of fun, especially when you have, green space around your house so you don't have to deal with traffic and your 6-year-old. And so that is one of our new things. But that reminded me of a patient I had about 2 years ago named Nicole, and Nicole was 47. Nicole had 3 boys that were in high school, and their favorite thing on the weekend was to go for bike rides, probably along the same kind of green spaces that are behind my neighborhood as well. And so she called very frustrated that she wasn't able to bike without her knee popping and clicking. And it was kind of freaking her out because sometimes it would swell up afterwards, but it was just thinking about all that popping and clicking was taking the joy out of spending time with her family. She was telling me that she just wants to find out what the problem is. And her doctor told her there was nothing wrong with her ligaments, there was nothing wrong with the muscle, they just couldn't find anything on the x-ray, and it's probably just arthritis. And so she let this go on for a couple months thinking, well, I guess I'm just waiting for a knee replacement. But that click was just so prominent while she was riding that she couldn't enjoy that time anymore. And so she's getting beyond frustrated. She's like, I'm 47. They're not going to give me a knee replacement anytime soon because they're saying that the arthritis in there isn't bad enough. But I need to enjoy this time with my family. This is just taking so much from me. And I was like, well, there's a lot that can go on with that. So she came in for the evaluation just so that we could see really what we were working with. And as I'm talking to her, I find out that this is not the only time that her knee bothers her. So she goes in to tell me stories about 2 or 3 years before this visit that her knee would randomly swell while she was sitting down, and it would take her 2 or 3 steps before she could walk normally. She used to run, but her knee was such a problem that she just gave that up. But that was something she did by herself, not with her family. So she was like, I just don't get to run anymore. I'm in my 40s, so people won't run in their 40s. She now was having problems going up and down the stairs. And it was popping and clicking every time she stood up from whatever random seat. The commute to her work was becoming more aggravating. So her knee would be swollen and irritated through most of the day. And I was like, you didn't lead with that? Like, that seems pretty major to me. She's like, but that's not, whatever, I can work through all that, right? That they already told me I had arthritis. This is all just part of it. But I cannot give up spending time with my family. This is limited. My kids are getting older. They're going to move out. We're just not going to have this time anymore. I cannot give this time up. So whatever you need to do, let's just do it so that I can get back to riding with my family. So after we do the assessment, I find out, just through watching her move and how everything is, working together, that she has patellofemoral syndrome. So patellofemoral syndrome sounds really horrible, but basically your kneecap is supposed to run up and down along a track. And it has its own groove on your femur that it's supposed to slide up and down on. And for her and for a lot of other people, what happens is that kneecap is actually getting pulled out to the side, and as it's being pulled out and pushed back in, it makes a popping sound, just like your knuckle would pop if it's, you're popping your knuckles. But it can mean that there is such a muscle imbalance that the knee joint isn't stable and it's causing irritation or rubbing, which makes things swell, which unfortunately makes the whole problem worse because when you swell, then everything gets unstable and it doesn't feel good, and it causes a lot of pain and other dysfunction. And so that's what she was dealing with. So she would go on these bike rides, and she was willing to deal with a lot of discomfort while she was riding her bike so that she could be with her family. But it was causing so much irritation that over time it was just compounding on itself. And so it not only spread from just being an annoyance through her everyday life, but it was taking away the most important activities of her life. And so she was not able to just wait for the total knee replacement, which is basically what her doctor told her she was doing. So after working with me for a few weeks, she realized that a lot of that pain was going away. She could now stand up from chairs and her knee didn't pop. It didn't click. She wasn't randomly swelling throughout the day. The bike ride, she was actually able to keep up and almost beat some of her kids now. So to say that she was excited is a little bit of an understatement. But it didn't take much, and she was like, that's all it was? I was thinking that my joints were completely, deteriorated, and I'm just old, and everything's going to come to a screeching halt in a few years. And I was like, no. We're still young, 40s, 50s, 60s. Our joints are made to last into our 100s. And so as long as we're taking care of ourselves and doing the right things and learning how to maintain balance, your joints are going to last a long time. And so Nicole is somewhere off biking with her family, and now I get to try to learn how to do the same thing and see how much fun it is to watch my son super excited when he can make it over a curb and not fall off his bike. So if you are also dealing with knee pain while you're biking, and you are interested in this type of care, I will leave a link below so that you can call and ask about availability. But if you're still a little bit skeptical on, whether or not your knee would possibly be able to benefit from this type of service, I save 1 or 2 discovery visits every week on my schedule to help make sure that we are a good fit. So if you call, we'll schedule that time, and you'll be able to come in. We'll do a short little assessment just to see if physical therapy or if I can help you. And if we can, we'll move forward. And if not, I will help you find the next best place for you to go so that you can fully get back to the lifestyle that you're looking to get back to. I hope you're having a great day.